Hello, I'm Adrienne Hanenburg from Roessingh Research and Development, Enschede in the Netherlands, and I'm going to talk about sleep measurement at home for elderly. First, the sleep disorders. For instance, in the Netherlands, 25% of the elderly has a sleeping disorder. 10 to 20% of those visit a physician, which means that a lot of people have a sleeping disorder and they don't know and they cannot be treated. The most common sleeping disorders are sleep apnea, which means stop breathing during sleep, having insomnia, which is trouble to getting asleep or staying awake during the night, and snoring, which means that they have sound during breathing while they are sleeping. These diseases can be treated. This can be done, like sleep apnea can be done by wearing a mask during the night, which gives them oxygen. Snoring can be done by wearing a mouthpiece. And for insomnia, they have like sleep medication, which can be done to get them falling asleep earlier. But first, we have to detect the disorders. How can we detect a sleeping disorder? The most common practice is polysomnography and a sleep diary. Polysomnography is done in a hospital and the sleep diary is done in-house for the patient. Both reduces a lot of data and this data have an overlap. And what we want to do is we want to reduce the data overlap from this. How did we do it? We did a literature research. And we want to know the state of the art of measuring sleep quality, sleep efficiency, and measurable parameters of sleep. And we did some interviews with healthcare professionals, and we asked them which sleep parameter do you measure to diagnose your patient. And we asked them also, what is the added value of polysomnography? This to know what is the overlap that we can reduce. Then, our first results. We have some subjective parameters and some objective ones. And the subjective ones are sleep quality, perceived temperature, stress, pain, feelings during the day, nightmares, and sleep quality. And the objective ones were total sleep time, wake after sleep onset, sleep latency, sleep efficiency, percentage in different sleep stages, and more. Then we have the sleep diary. This measures only the sleep medication, naps during the day, stress, feelings during the day, pain, nightmares, sleep quality, and perceived temperature. Sleep medication and naps during the day are the objective parameters and the rest are the subjective ones. Polysomnography is the one that only measures the percentage that a person stays in different sleep stages, breathing patterns, restless legs, and the heart rate of the patients. And then we have the one that is overlapped, as they are measured by both of them. That is the time in bed, the wake after sleep onset, the sleep latency, sleep efficiency, total sleep time, and the others. Then the future research. The future research can focus on reducing the effort for patients by measuring most of the parameters at home, and by reducing the effort for the physicians, and that can be done by reasoning algorithms which provide initial evaluations of the measured data. Okay, this was my presentation and thank you for your attention.